just a neck lift. Can I have just a neck lift? I don't want a facelift.
Stephanie, you're perfect.
Thank you.
Well, I guess sometimes you make your...
Yeah, check it out.
I
could use
Okay, maybe. Ooh.
Girl,
Ooh.
look at that.
People have a congenitally heavy neck where they just carry a lot of fat in this area under their chin, and they really want a sculpted jawline, but they don't have a lot of descent of their mid-face, right? So once you have a lot of descent of these cheek and jowls, then you really need to reset the mid-face. Otherwise, a neck lift might actually pull down those areas. But for a younger person in their 30s and 40s, a neck lift can be an ideal option for them. And so what is a neck lift? So a neck lift is a procedure where we don't make incisions around the ears. We just make a single incision about 2.5 centimeters behind the chin. We try to hide it in a nice crease. And what we do all from that is we reduce some of the fat in this area here, number one. Number two, there's two glands here called your submandibular glands. So they're two saliva glands. You have lots of other saliva glands, including the ones here and in your mouth. So problems with dry mouth is rarely a problem. We reduce part of those saliva glands. But the other thing we do is we support your neck with your platysma. So your platysma is two sheets of muscle on either side of your neck. And what we do is we bring them together in the midline, suture them together, so that we make a nice thing to really tighten up that jawline to give that ideal definition.
Oh yeah.
About it. So an isolated neck lift can be a wonderful thing for the right patient, and we're really excited to show our results moving forward.
What's the downtime like for just a neck lift?
Yeah, so it's a couple of weeks at least. So you really have to expect bruising and swelling around the neck. It feels very tight because that's exactly what we're doing. We're tightening those muscles together and really suspending it. So very tight for a couple of weeks, quite a bit of swelling, but that settles down. In 1 month, you're looking pretty good. And in 3 months, you're looking fantastic.
Fantastic.
Yeah, and people typically take off about 3 weeks after
Yeah.
a neck lift alone.
That makes sense.
Yeah, so what are the other risks? So it does require a general anesthetic. For a healthy patient, that risk is very small. Anytime you lift the skin, open things up, there's a small risk of bleeding, small risk of infection. There's a bunch of nerves that we need to be careful about. There's 2 little nerves to the corner of your lips. There's 2 big nerves to your tongue, sensation of the tongues. The chance of permanent injury to any of those is extremely small. But almost every patient just gets some numbness, and I use my 3-finger rule. So the numbness decreases month by month. So after 1 month, 2 months, 3 months, and most of that numbness completely resolves. And most people do extremely well.
Yeah.
Let's go. Okay.
Ready.